Hi everyone, welcome to Maju. I'm Tony Chen. I'm now the Associate Dean of the College of Public Health. I'm the organizer of these meetings. And we are going to have an international conference on precision science on life in Maju. And we are so great because in this meeting we are already invited many experts from abroad, like the Professor Elizabeth Westpass, who is the next director of the IC of WHO. And also, we also invite the senior scientist from UK, and who has been involved in the advanced study aspect in UK, famous the longitudinal flight study in the world. And of course, we also invite many elites in South Asia country, including Korea, including Malaysia, Thailand, and also other countries. Let me give a very brief introduction to why we have an international meeting in Maju here. In addition to our long-standing community-based service in Maju for the people here, and the most important thing is our College of Public Health, National Taiwan Universities, is the fourth College of Public Health accredited by SHIF, which is the most important evaluation system in public health in ASPPH. And because of that, we just got the support and funded by Ministry of Health and Science of Technology to have a research project and educational project named as Population Health Research Centers. And this project is led by our current Dean, Professor Chang Qian-zhang. Let us welcome our current Dean to introduce how they did this team to run this project.
I'm Chang Qian-zhang, Dean of College of Public Health of National Taiwan University. I have been doing a lot of work on environmental and occupational health, both on exposure assessment and epidemiology. And in the past 10 years, I've been working on a study about petrochemical industries pollutions, and I work from the emissions, exposures, assessments to epidemiological studies, and we have found many adverse effects of petrochemical pollutions on residents living surrounding this petrochemical complex. In the past 30 years, I'm also working on air pollution, especially PM 2.5, and we have continuous study to document PM 2.5 effects on cardiovascular diseases, stroke, kidney diseases, respiratory diseases, and cancers. So our study is a foundation of Taiwan's government's regulation on PM 2.5. Most recently, I lead the college-wide study population health research centers. We are going to conduct a 5-year study on this community-based approach on population health, covering from disease screening, interventions, and care effectiveness evaluations. And Maju will be one of our communities. So in the coming years, we will come more frequently to this place to work with local governments to conduct. I think it's one of the world's leading research on population health. This is a brief description of what I am doing. Thank you.
Hi, my name is Wei Jian Chen. I am currently a professor of the Institute of Epidemiology and Preventive Medicine. I serve as former dean of the College of Public Health, and my research area is about psychiatric epidemiology. And particularly, I study two themes. The first is about schizophrenia. So, for example, we have completed recruit more than 600 schizophrenia patients from multiplex family. That means in each family there were at least 2 individuals affected with schizophrenia, and we have subject those families into linkage analysis. And more recently, we also recruit about 3,000 schizophrenia patients from sporadic cases, and their both parents as a trio. And some of those trios have been subject to GWAS sleep genotyping, and some interesting result has been revealed by those kind of GWAS study. And we also try to utilize our national health insurance data to study the healthcare outcome for patients with schizophrenia. So, for example, we found in the first 10 years after the implementation of national health insurance system, the first admission rate of schizophrenia have decreased more than 30%. My second theme is about substance abuse, and so I have studied patients with alcohol use disorder, and I also study people using illicit drug. And starting in 2014, I was in charge of the first national survey of substance use, particularly about illicit drug use. And we have come up with some interesting finding about the epidemiological features of illicit drug in Taiwan. And currently, I was conducting a new survey of a similar design, and expect to complete by the end of this year. And based on those studies, we found that illicit drug use in Taiwan is quite different from European or American nations, because we have a much higher prevalence in methamphetamine, and now many young people are using ketamine. And so with those background, I hope to have a very interesting interaction with all the participants. Thank you.
Hello, I'm Professor Kuo Piao Michael Chom. I'm right now the Director of Institute of Health Policy and Management, College of Public Health, NTU. I earned my PhD in 1995 from Johns Hopkins University, Bloomberg School of Public Health. My research area including 2 parts. First part was quality management in healthcare organization, and the second part was the quality measurement in healthcare organization. Regarding the quality management, right now I'm working on a 3-year project from the Ministry of Health, Science and Technology, including the topic to try to develop a model about the dynamic model for hospital implementation of quality management, and the project after implementation effect. We try to, based on some qualitative approach, to develop the dynamic model, something like that. The second part regarding the quality measure, in the past research area, I just try to develop some major quality indicator, especially focused on cancer care. So right now the Health Promotion Administration, they have several cancer care core measure based on our previous effort. But right now, we have another pay-for-performance project, which is funded by the Minister of Health and Welfare. It is a project more than 5 years. Actually, we collect many indicators from different hospitals. Right now, there are more than maybe 400 hospitals to join the project to report the quality indicator, aggregate and patient level data, so we can provide feedback to them. Recently, right now, based on the Ministry of Education, we have a 5-year project regarding the patient and the family center, and help them to collect all the different opinions, how to collect those ideas regarding the patient center, especially when they have the discharge planning. Is there any possible to extend the idea from patient center combined with the long-term care? So this is basically my past research. In addition, I also have some study regarding the national health insurance, regarding the service quality, and some have other working area to some extent to, for example, long-term care. So in addition to my working area, I have several research partners to have from hospital. So based on the quality management and the quality measure, which is the research and teaching area for my past 20 years. Okay, thank you.
Hi, this is Cha-Yang Chen, and I'm a professor at the Institute of Environmental Health and also a director in food safety and health. And basically, I use a lot of analytical techniques and apply them to the public health issues. And let me show you some of my research examples. Like the first one, we analyze lots of illicit drugs in the municipal sewage of Taipei City. So by this way, we will know what are the common used illicit drugs in this community and what is the average used amount. And this approach can also be used to livestock. For example, we analyzed various veterinary drugs in the effluents of the farms. So we can know are those drugs have been used properly. And we also have analyzed such as aflatoxin M1, mycotoxin, in milk samples at different seasons. So we will know the different seasonal variations, and also some of the ochratoxin A in different coffee drinks. So by collecting the concentration information and integrated with intake or demographic information, we can do Monte-Carlo simulations. So we will provide the accumulated health risk percentiles. So we also analyze some endocrine disruptors in water, sediment, and various fish organs. So we will know what are the partition coefficients of those compounds between water and sediment, as well as what are the accumulated concentration of those compounds and their resulting ecological health effects. And recently, we put a lot of efforts on non-target analysis using biospecimens with high-resolution mass spectrometers. For example, we can see more than 5,000 peaks in the serum sample. And by comparing the precursor and the product ion information with libraries, we can identify, okay, what are the common found compounds in the serum samples. This will help us a lot to prioritize our next work. So in briefly, we are capable of developing and utilize the state-of-the-art analytical techniques and for the exposure of health risk assessments. So I look forward to any collaborative opportunities with you in the very near future, and thanks for your attention.
Hi, my name is Duanrong Chen. I'm a professor and the director of health behavior and community science in College of Public Health. I'm also a director of a research center for population study. I have an academic background in sociology and the social network analysis. My primary research interests have been focusing on community and the neighborhood effect of health inequality, the sociology of obesity, and social network dynamics. My major research focusing on social network mechanism that explain how health behavior and knowledge can be formed, copied, and transmit, and how the social capital can be developed in a co-production activity within communities. I currently working on three major issues. One is related to social and psychological outcomes of weight discrimination across different life courses. For example, like adolescence, from adolescence to young adult. And I also working on social factors associated with adolescence on sugar-sweetened beverage and drinks. As you know, the prevalence rate of overweight and obesity in Taiwan in adolescents has been increasing during the past few years. And I also working on issue related to technology used in increasing active aging and dying. I thank you very much for coming to this conference, and I'm looking forward to sharing ideas with you. And thank you very much.
Hello, my name is Yukang Tu. I'm a professor and the director of Institute of Epidemiology and Preventive Medicine. My research area are life course epidemiology and evidence synthesis methodology. Life course epidemiology is to look into the relationship between what happened in our early life and the health outcome in our later life. It usually requires a large cohort to follow people for a long period of time. I have been developing new method for comparison of multiple treatment. Traditional meta-analysis is to compare two interventions or one treatment with placebo or control group. However, in many clinical scenarios, we have to know which treatment is the best among many available treatment options. And network meta-analysis is a new methodology which can give us the answer about which treatment is the best for our patient. Recently, I have been also using National Taiwanese Health Database. One of our PhD students is looking at the relationship between invasive dental treatment and infective endocarditis. Our research shows actually there's no connection between invasive dental treatment and infective endocarditis, which has been a controversial issue for a long period of time. And our result has been published in the top cardiology journal Circulation. And our result is very likely to change the current practice. I have been working on many collaborative projects with people around the world. I have been working with people from US, UK, Brazil, Germany, and Italy, which generate a huge amount of research published in international journals. I welcome any opportunity of collaboration. Thank you.
Hi, I'm Dr. Yi Jiali from the National Taiwan University. I am a gastroenterologist and I am also an epidemiologist. My primary research interest is focused on the cancer screening and the prevention, specifically for the gastric cancer, upper airway digestive tract cancer, and the colorectal cancer. Take gastric cancer as an example. We have launched a population-based cohort study in this island, the Matsu Island, which has a traditional high incidence rate of the gastric cancer. We applied the method of the H. pylori mass eradication, and those who were test positive will receive an effective treatment. Using this approach, we have launched the mass eradication program for 6 times up to this year. And we found that the incidence of the gastric cancer substantially declined about 50%. So that is a very significant success for this island population. In addition, we also find that the peptic ulcer risk is also substantially decreased in this island population. That means that the health of the stomach of this island population has substantially been improved. So this is the first time in the world that has applied such a mass eradication treatment for the whole population to against the high burden of the gastric cancer. We believe that our vaccine have a substantial contribution to the world campaign to against the gastric cancer, and can be applied to other population at risk, and the risk of and the burden of the gastric cancer can be nearly eliminated from the world. So I believe this is a very important achievement of our Mazu Island gastric cancer prevention program. Thank you.
As you know, students are always our asset and very important. So the next sessions, students will join with our PHRC project to tell us what is the content of this project.
The first project is talking about environmental factor monitoring. Elias, hi.
Hi.
So can you expand more on these topics?
Yes, I think as we all know, the development of chronic diseases and cancer is closely related to exposure of various sources of pollution in life. But as we understand very well, the pathogenesis is quite complicated. Therefore, understanding the related mechanisms and the early screening and prevention and the evaluation and control of potential pollution sources and environmental factors that may be able to induce chronic diseases can provide useful information.
Is bioenvironmental exposure monitoring and evaluation program. May go on to introduce this for us.
Thank you, Wendy. In this project, we incline to explore or develop multiple exposure studies through integrated platform of warming data, including proteomics, metabolomics, and epigenomics, through the use of measuring or quantifying the metabolites in the urine or blood by systematical environmental monitoring survey.
A population level integrated screening or health checkup program is the main focus of our PHRC center. So, Grace, could you introduce this project for us?
Okay. The third project is Community Integrated Health Promotion and Health Education Program. In the overall population level, the most important part of health promotion and health education strategies is to reduce the risk of disease and prolong the life of the population. The integrated health education defined in this program is implemented in Mazu and Zhanghua community.
Does anyone know what the project goal is? Let's find some students to figure out. Hi. Do you have any ideas of what such project goal in PHRC is?
Yes, project 4 is about community prevention strategy. Generally, there are 2 main strategies for prevention and treatment for chronic diseases such as hypertension or diabetes. One is the population-based prevention strategy like some lifestyle change, and the other is the high-risk prevention strategy by risk stratification like Framingham risk score.
Actually, in this time, we also do many personalized prevention strategies because everyone might have different kinds of genes, lifestyles, and environmental exposure, so that everyone has different risks to get the disease. Based on this, developing a personalized risk assessment model to predict the risk for everyone is very important.
The project 5 in PHRC is also use personalized strategy that apply to cancer prevention.
Oh, cancer prevention, we know.
Oh, you know?
Yes.
So would you please talk more about this?
With the advancement of medical technology, the intervention target of cancer prevention are moved forward from the later stage of the disease to the early stage of asthmatic patients.
We developed a multi-stage, multi-risk factor model which combined the integrated community cancer screening in Type 1 with the prospective research designed to collect factors related to disease.
Patient-centered care model is also an important topic in our PHRC. So I'm going to invite Sarah and Teresa to introduce this.
Taiwan introduced national health insurance in 1995, and the patient-centered care model is the focus of management in hospital in recent years. And I think that is something necessary to do. So,
yes, it's necessary to take into account the experience of Western society and meet the needs of the local community to establish a local personal-centered care model from health check-ups, emergency service, hospitalizations to discharges.
So in our PHRC center, the sub-project 7 is mainly focused on healthcare intervention and also the evaluation to improve care coordination. I'm going to invite Emily and Foxley to introduce this sub-project for you.
We all know there is evidence that higher care coordination can improve the care outcome of chronic patients and reduce medical costs. So there is a reason why there is a need to develop innovation intervention service model. So Foxley, would you like to talk about it?
This project has the following 3 objectives. Objective 1, to make good use of health information technology to develop an innovative approach that enhances care coordination, healthcare program. Objective 2, to provide healthcare services with an experimental intervention and conduct rigorous benefit evaluation. Objective 3, to combine cloud health insurance information, medical record data, patient and physician visit data to develop value-added applications.
The last special project is mainly about the Big Data Science Center. Let's have Dr. Xu introduce it.
One of the cardinal elements of PHRC is the implementation and realization of big data on healthcare in terms of not only the population level but also the individual level. Through big data technique and analysis, all the analytical strategies from visualization to decision making based on the finding from environmental influence, healthcare delivery, behavior determinants, and the epidemiological risk factors with synthetic science will be used to develop the application software of artificial intelligence in order to realize the goal of precision population health. Hope you match our match conference.